I'm Mary Baker, and I'm very proud to be one of the patrons of the European Parkinson'd Disease Association. The European Parkinson'd Disease Association have got a wonderful campaign at the moment. They're focusing on the non-motor symptoms of Parkinson's disease, which I think are very under-recognised still. Sleeplessness, fatigue, bowel problems, bladder problems, sexual dysfunction, all of these things are very important non-motor symptoms. So it's great that they're recognised, people can talk about them more, and once you can begin to talk about them, I think that gives great relief and a better understanding. We're very uncertain when the non-motor symptoms first appear. I think to begin with, people say they experienced feeling depressed and feeling rather low and rather anxious, but it was all very unexplained. And these may be, not yet proven, may be the sort of precursors to the appearance of the illness. So there are other little clues too that are beginning to appear. For instance, when my mother was diagnosed with Parkinson's, for about at least 2 years before diagnosis, she would be talking to me about how she'd lost her sense of smell. And it seems a strange thing to sort of talk about, but imagine my surprise when I see now there's a lot of work being done. So pre-Parkinson's disease, sense of smell is lost. So it's these little clues which are beginning to emerge that these symptoms are there, non-motor symptoms, prior to the diagnosis. We're all hoping for a cure one day, but in the meantime we have to live with a better management of the illness. And it's much better to be treating all of the symptoms than just the ones that you can see. You know, it isn't just about let me see you walk. It's much more about how do you feel? What are your main concerns? And I think for both doctors and the patients, to get that dialogue going is good for the patients and their families. It's good for the doctors too. They learn a lot more about managing the illness. My aspirations for the people living with Parkinson's disease is that they will begin to recognise and understand that all those symptoms they were feeling and were wondering what on earth they were can now be voiced. They're recognised. They are the non-motor symptoms of Parkinson's disease. They're the hidden face of this illness. The impact of these non-motor symptoms goes way beyond the person living with the Parkinson's disease. It impacts the carers, the whole family. To live with somebody who's overly anxious or depressed is difficult. Tempers are short. That impacts very badly, doesn't it, on the relationship with your children and your wife or husband. So it's very necessary to recognise these non-motor symptoms, to recognise them as playing a major part in the quality of life. And this causes terrible distress, and it also costs a large economic burden to any of the health systems.